Good afternoon, everyone. Um, our topic today is working with people with developmental disabilities. Working with people with developmental disabilities. Um, so when we look at it, before we dive into the discussion proper, let's take a look at what the context of the topic itself is. Working with people with developmental disabilities. There is a key word here, which is developmental disabilities. As the word sound in itself, developmental. We all know that as soon as a child is born, a child is expected to grow and develop. Now, there is difference between growth and development. Growth is simply increase in size and mass, structure, like just structural increase, while development is maturation or exhibition of what the expected from these organs. Now, let me use an example to clarify. A baby may grow. We've seen cases whereby a child of 5 years old, of course, this child is expected to walk, to be able to, move from one place to the other. Now, growth means this child has grown, the legs, yes, the legs are grown. The one leg is not shorter than the other leg, the legs has increased in size over a period of time. But then lack of development now is the child not being able to walk. So every at a particular stage of life, there is an expected task to perform. So if the child is unable to perform that task, we say the child did not or has developmental disabilities. So let's go briefly into the introduction. In this module, we'll be discussing how to explore with people, we will explore how to work with people with developmental disabilities. Then we'll discuss what it means to have developmental disability and some of the causes of disability and how normal functioning can be affected. We also take a closer look at some specific developmental disabilities such as intellectual disabilities, cerebral palsy, autism, and neurological impairments. Then we'll talk about how to best help meet the needs of a person with developmental disability by exploring the Maslow's hierarchy of human needs and how they apply to a person with a developmental disabilities. And finally, we'll discuss what the role of a home health aide or a personal care aide is in the home of a person with a developmental disability. So the first thing we'll be considering is what it is. Now, what is developmental disability? I believe when we started, I said something that it is when the way I said it in a layman's language, a child not being able to perform a specific function at an expected time. Of course, you would not call a child of 3 months, you wouldn't say he has developmental disability because he cannot walk. No. It's, of course, at that stage, the child is not expected. But then a child of 1 year, 2 year, 3 year should walk, should even run. Good. But then not being able to perform this task, we say this child has what? Developmental disability. So the first definition here is a developmental disability is an impairment of functioning. An impairment of function. When we say impairment, we mean when something is preventing something from happening. Now, looking at it, impairment on functioning, inability of a particular organ or this structure or this person to function. It's functional impairment may be both physical, that means they affect the body, or cognitive, that means they affect the mental functioning. As we all know that diseases are both physical, or impairments, disabilities are both physical and cognitive. Cognitive means that they affect mental functioning, and anything that affects the mental functioning, I think it's not even a good condition at all. Developmental disability is also a disability that may affect physical, cognitive, learning, language, or behavioral development. Now, it affects physical, physical as in maybe the child is not able to walk. Cognitive, that is mental functioning. Some children are, they have some certain condition that has to do with the brain. For example, autism or uh, cerebral impairment. Then we have learning. Some child they have, learning also is learning happens in the brain. So if you look at it very well, there are majorly two things. It's that it is physical or it is what? Mental. That's psychological. Good. That is which is also cognitive. So ability, not ability, inability to learn is also what? Going back to the brain. Then language disability, they're all behavioral development. So all these things can be characterized under what developmental disability if there be at any point impairment in its ability, that the ability to do learning, to do language, to cognize or physically to move around and etc. So this means that there may be a developmental delay in the normal development, how a person grows and functions, or an impairment of functioning. So the person may not be able to function according to the normal development processes. So two things would have happened. It is either the person did not grow well. That means how a person grows and functions, there's a delay, a developmental delay. Some children start working at 8 months, while some at one, while some at 1 and some months. Now, there may be developmental delay when a child of 2 years is yet to walk, although he may finally walk, but then at that stage, he is categorized as what? A developmental disabled person. So it may be developmental delay in the normal development, or it can be an impairment in function. For example, a child not being able to walk because the leg is maybe the legs are not working, but the legs are growing, but there's no strength to carry the whole body. So developmental disabilities also occurs across all gender. It is not a reserve of one gender or race. So it does not it occurs across all genders, all race, all ethnic groups, and socio-economic groups. And according to the CDC, the Disease Control that is Commission, about 1 in 6 children have a developmental disability or a developmental delay. So we see in our world today that a lot of children are giving birth to that has developmental disabilities. And looking at a picture here, now this child is on a wheelchair, not being able to walk as a result of what? There are two things could have happened to this picture now. It is either the legs can't carry the weight of the body or the spinal cord has an issue. So in either ways, the child has lost his ability to walk. Now, seeing a child in a wheelchair, it can be physical as a result of the legs not working, or like the legs not being able to, he can't walk with leg, probably because the legs is fractured, is broken, it didn't develop. Maybe the bones there were so thin that they were supposed to increase in mass and size and it didn't really increase. That could be the reason why. And again, it can be that something has happened in the brain that has made him to lose motor functions of those legs. So another definition of developmental disability. Developmental disabilities begin in young childhood. It begins in young childhood and it may impact a child's ability to function in one or more areas and may continue throughout the person's life. Developmental disability may necessarily not be permanent. Like we said, that it could be due to developmental delay. In those cases, those children finally regain or the ability, they become able. But in some cases whereby let's say the legs were paralyzed or there is something that happened in the brain that causes a loss of motor reflexes, this thing may be permanent, maybe throughout the person's life. So as parents and caregivers and teachers and medical professionals, we notice that a child is not progressing according to normal development milestones. Now, there are things called developmental milestones. Of course, we know of every child, we have different people who has um, categorized a child's development in different milestones, like Freud. Sigmund Freud categorized child under the oral stage, the anal stage, the phallic stage, the Oedipal stage, and that's the Oedipal conflict. Then we have the latency stage, still categorized under the Oedipal conflict, and final stage, genital stage. Now, each stage have its specific traits and specific functions we're supposed to what exhibit. So if there is progressively a delay whereby a child who is supposedly should be at the uh, anal stage due to the age, I think the oral stage should last from 0 to 18 months. That's 1.5 year to be specific. And now a child of 1.5 year is still exhibiting characteristics of the oral stage. You should know there is something going on with the development of that child. So according to developmental milestones, according to how a child should develop, it's expected that a child of lesser than one should should exhibit some certain traits, some certain characteristics. But a child of 3 years old should not exhibit the same characteristics as a child of one. But if in any case, both physically, mentally, behaviorally, in learning, a child of one or a child of 3 years old cannot still produce words. Of course, this is a developmental disability. A child of 5 years old cannot walk, or let's say fine, he's walking but cannot even run. That's what a developmental disability. So for example, around 18 months old, a child is able to walk and is beginning to feed themselves and can say several words. Around 5 years old, a child typically speaks clearly and print letters and numbers. They're able to toilet themselves and can do some things such as hopping, skipping, or jumping. Now, when parents and caregivers notice that this child is not reaching typical developmental milestones, they may express their concern to a medical professional. So at this stage, when you see that your child is not uh, exhibiting those characteristics that a child of their age should, of course, please seek medical concern, seek medical attention. Now, the medical professionals can assess the child by using a variety of developmental screening tools. Now, how does developmental delay affect normal development? How does developmental delay affect normal development? Now, having a developmental disability can affect normal development in varieties of ways, and it depends on the type of developmental disability the person has. Now, first is self-care and movement. So let's consider this type of developmental disability affecting the normal development of the person. First thing is self-care and movement. Now, a person may have trouble performing activities of daily living, that is ADLS. When you say anything called ADLS, it means activities of daily living. Activities of daily living. Now, independent. So the person may not be able to perform activities of daily living. What are the activities of daily living? Such as bathing by themselves, eating for themselves, skipping, jumping, running, playing, toileting, doing dressing, bathing, and such tasks. So they may not be able to perform such tasks, such as bathing, dressing, toileting, or feeding themselves. And if these developmental disability impact their physical functioning, the person may have trouble using their muscles. They may, for example, be unable to control their muscle movements, and this may affect their ability to perform activities of daily living, to walk, to get up from one place to the other. Like this child in this picture, if you look at it closely, there is something wrong with the legs. Thank God for the advent of, for the improvement in technology. A lazy child can move from one place to the other. But trust me, he cannot perform so many activities. This child cannot skip. This child cannot run. The highest he can do is just to move. So he has been what? There is impairment in functioning as a result of what? the disability. So affecting his ability now towards to perform specific tasks for himself. We said having a developmental disability can affect normal development in varieties of ways. Now, what is normal development? Coming back to this picture here. Now, what is normal development? Normal development is a child of that age, of this age, should be able to at least engage in some sports activities, as such as maybe jumping, skipping, running, uh, and some other sports like that as the child would. But looking at the child in this condition, he cannot perform such tasks. So as a result, you wouldn't now as a result of it, he may, let's assume the child is 6 years old. He should be able to perform those tasks I just mentioned. But due to the developmental disability, those activities have been impaired. Those functioning has been impaired. He can't perform those tasks. So we say they may be unable to perform tasks such as bathing, dressing, toileting, and feeding themselves as listed. Number two, financial independence and self-direction. Please, let's not forget that we are talking about how developmental disability can affect a normal development of a person. And under normal development, we know that this normal development is the thing that a child or a person should on a normal basis do. Now, the second here is financial independence. A normal human should be able to what? Work, like WORK, to work and earn for themselves. But then when there is developmental disability, now this will affect the ability of this person to work for themselves. We see those of us in this part of the country where a lot of people, you see a lot of disabled men begging on the streets. Why? They don't have financial independence. They have to depend on someone. So they lack that independence as a result of the developmental disability. So difficulty or inability to perform a setting and to perform in a setting such as work can impact a person's ability to provide for themselves and support themselves financially. Imagine someone who has lost motor. Okay, this picture I even showed us just now. Imagine this guy. Literally, there are varieties of things he can do. If this child attempts to find himself in a country like ours, where white collar jobs are not so common, you have to fend and struggle for yourself. This child will definitely run into financial crisis. Fine. We have some countries that gives varieties of work where you can maybe probably work at home, be on your laptop. His hands are okay, of course, as you can see, the hands are okay. He could probably move the bike with his hands. So he could maybe use the laptop and earn. But then in a country where you need to work, like when I mean work with your hands and your legs, of course, this child is going to run into financial crisis. So this impact the person's ability to live independently. They can't live by themselves. They have to live on someone. They may need to rely on others to care for them or for their entire lives. Now, if a person needs to depend on others to care for them, they may feel an inability to make choices for themselves and to control the direction of their own lives. Of course, even in movies, if we don't have real life experience to relate this scenario with, even in movies, we'll see that if you depend on someone too much, now you cannot fend for yourself. In this case, now they can't even fend for themselves at all. Now, when you have to depend, you have to put all your bills, all your financial needs on someone. Can you make decisions for yourself? No, you have to live by the decision made by such person. Now you have to calculate your life based on the amount of resources provided. So you can't necessarily decide for yourself. You can't decide that okay, I want to take this, I want to take this. You have to structure your lifestyle into what you have and what the person gives. So this person will need to depend on to depend on others for opinions, for directions, for factually everything. So anything that has to affect financial independency will also affect self-direction and self-independence. Now, the next one is communication and social situation. Communication and social situation. It is common in our world these days, people naturally segregate those with developmental disability. We don't want to be friends with them. We don't want to have anything to do with them. We don't want to, some people even used to have these mindsets that some of these things are communicable. So I don't want to go close to him so that I would not become like him, or I don't want to close to him because I want to give a birth to a child that looks like him. Those kind of mentalities. It makes these people segregated, make them secluded, like they can't associate. So communication, they can't really communicate with themselves, with people, because no one is even ready to listen to them. So people with developmental disability may have trouble communicating with others. They may have difficulties with speech, themselves being the one talking here, or understanding speech. It may also affect their ability to write or read. For people who have mental, cognitive disabilities, they may not be able to speak. Now, in such cases, they can't express themselves. They can't express their wants. They can't express their wishes. They can't express the things they don't like, their hates or dislikes in words. And some people have difficulty understanding speech. Maybe they have ear impairment, that when you have to shout at the top of your voice to pass information across to them. So or some of them have low reasoning ability. Like when you even talk to them, they don't get to understand you well. So you have to explain and explain and explain. And this naturally impedes their ability to communicate and have a social interaction. Then again, writing, some of them may not be able to write, maybe because they have a motor dysfunction that affects the hand, or they may not be able to read as a result of what? The disorder in the brain. So the person may have trouble in social situations. Of course, in addition to communication problems, they may have difficulties understanding social situations. So most of them are living in a world, but they are not part of it. How do I make this clearer? Fine, they are with us, but then they don't really understand the concept of our world because of these disorders. So they may have trouble understanding social cues and things like non-verbal communication as well. And this can be a source of great frustration for the person with a developmental disability. Imagine those of us that grew up in the Yoruba side or some other side of the country where parents train their children to understand sign language. So every little sign has its meaning. Now, because you you are not developmentally disabled, you're able to understand these signs. People even go to school to study sign language. Exactly. Now, imagine a case whereby a person who cannot speak, cannot talk, that's the same thing, speaking and talking, cannot understand, and still doesn't understand sign language. This can be really frustrating. So this can be a source of great frustration for those persons with a developmental disability, and having difficulties communicating with others can impact their ability to make friends and have the social support they need. And this may impact their ability to perform in school, in work, and in social settings. So looking at this picture now, this person so secluded, and the friends are even laughing and talking about her. So because the fact that they can't even talk, fine, they would have been able to mingle a little bit, even if they are not if they are not secluded. But then their disabilities makes them secluded, differentiate them from others, make them obviously different from others. And no one wants to associate with those kind of persons. So it makes it even more frustrating for them. Now, the next thing is coping. It affects their coping ability. The person's ability to cope with stressors may also be what impacted. Now, if the person has difficulties physically by performing has physically that is physically performing tasks or moving, communicating with others, or being understood, or supporting themselves physically and financially, they may have many different emotions. Now, they will feel angry, they will feel frustrated, they will feel resentful, they will feel depressed, they will feel hopeless, guilty, and even embarrassed. So these people will lack the ability to be able to cope with the stressors. Now, there are a lot of stressors in our world. Even those of us who can move or do all these things, we don't have any developmental disability. We see how stressing it can be to cope with the stressors. Now, imagine people in this condition whose ability to cope the developmental disability has impeded their functions, and they cannot even perform so many tasks, moving, talking, being understood. Nobody's understanding them. They can't even support themselves physically. They can't walk. They can't help themselves. They have to depend on someone to wear them clothes, to cook for them, to feed them, and financially they can't even fend for themselves. They are just living on someone else entirely. They have a lot of emotions. They feel angry, having mixed, they call it mixed emotions. You don't even know what you feel. You feel angry, you feel frustrated, you feel resentful, you feel depressed, you feel hopeless, you just want the world to just crash on you, and that's the feeling they have. And they also have hard time letting others know their needs, because first of all, even if there is someone to hear them out, how are they going to express themselves? Then secondly is there is factually no one to hear them out. And that is why as health aides, we come in these conditions, we come into these lives to help them, because literally nobody's ready to listen to them, nobody's ready to listen to how they feel. So it makes it even more frustrating for them. Now, families with a person with a developmental disability may also have difficulty in coping too, because this person may not be able to tell you, okay, let's say someone who cannot even talk. He can't tell you he's hungry. You have to figure that out. He can't tell you he wants to pee. You have to figure that out. You can't tell you he wants to use, maybe he can't really express himself. So as the parents just have to figure every single thing out by themselves. So even for the parents or for the families of these persons, it is even more frustrating for them. So home health aides or personal care aides, we can help by providing the emotional support the patient and family needs, in addition to providing assistance with physical tasks as feeding and dressing up. So that is where we come in as health aides. We understand better what those people pass through, even without them explaining themselves. So we know the gravity of how this thing can be. We know how it feels like. So we are here to help them emotionally. And trust me, anything that affects someone's emotion has or will totally affect other part of his life, because your emotion has to start from your mind, which is your psychic, your brain. Anything that affects that will tamper with every other aspect of the person's life. So emotional stress, emotional difficulties are have a higher impact on someone's general being. So as health care or health and home health aides and what personal care aides, we can help by what providing this emotional support the patient needs, and even the family of this patient. And in addition, we assist them with tasks such as feeding and dressing and all that too. And the picture expresses the person that is, she's stressed and she's not been able to cope with the stressors, and now some of them will develop anxiety disorder. Yes, things for coping. The picture says things for coping with anxiety disorder. So most of them become anxious. Most of them become a lot of things can set in. when the mind is affected, it opens a gateway to varieties of other illnesses or other things to setting. Now we are moving to the types of developmental disability. Just a brief brush back from where we started. We started from the definition quickly, and we gave an introduction. Then we said what developmental disability is, and we explained that, and we talked about the how developmental disabilities can affect a person's normal development. I'm talking about self-care development and self-care and movement. And we talked about financial independence and self-direction. We also talked about communication and social situation and coping. Now we are moving to types of developmental disabilities. Developmental disability is a word that categorizes so many developmental disabilities, like so many disabilities. So now we want to be specific with what we are treating. So let's pick it one. I will consider a few developmental disabilities and see how they affect how they affect the person's general well-being and functioning. So the impact on functioning ability to achieve developmental milestones depend on the type of developmental disability the person has. Remember, each person is unique and has different strengths, different talents, and different areas that they need help with. The help you will render to a man who was a person who has a type of developmental disability that affects the motor uh, functions like walking is not the same for someone who has difficulty in speaking, and it's not the same with someone who has difficulty in understanding. So these are different varieties of what developmental disability, and each has their or its specific uh, function, or rather the functions. Yes, that's what you will do for them. So let's pick it now. So remember that each person is unique and have different strengths. No child is no child is replicated in two. What do I mean? We don't have two same person. We may have two similar persons, but we don't have two same persons. So every person is unique. Unique, unique is that's just the only word we can use for now. Everyone is unique. We have different strengths, we have different talents, we have different areas that we need help. So this is true for all persons, including people who have developmental disability. Every human being needs help, whether you have developmental disability or you don't. We need help in one area of our life or the other. And that is why you see some persons, they may not show any developmental disability, but they have problem. They may not have developmental disability, but they have problem with their, let's say, coping with life stress normally, and they seek for help. Some people have health challenges and they go to the hospital to seek for help. So imagine if you, as a normal human being, I'm not saying they are not normal, but as someone who is developmentally able, you still need varieties of help. How much more those that have developmental disability? Now, the type of help rendered to those people who have developmental disability differs depending on what type of developmental disability they have. It is important to always remember to treat each person as a unique individual who has strengths, who is part of a family, and who can make a positive contribution to their family and community. I used to follow a guy on TikTok. I can't remember his name for now, or he has a kind of mental disability that made him lost. He doesn't have an arm, then the other arm is fine, is okay, and the legs are quite short. So he's like, I wouldn't call that a dwarf because half up he's okay, but half down so minimized, like the legs are so short, like a baby's legs. But this guy is a motivational speaker who speaks and has helped a lot of people come out of depression. Now, just imagine this particular person was neglected or written off. A lot of souls that were blessed by him would not have been blessed. So we see that each person is unique, and in one way or the other, with or without a developmental disability, have one thing or the other to contribute to the society, to their family, and even to the world at large. So every person, regardless of having special needs, they have the same physical and emotional needs as everyone else. So we should not neglect the fact that they don't look like us, or the fact that they have a particular developmental disability and we feel like they are aliens. No, they are not. They are also humans. They feel what we feel, they see what we see, they experience the same thing we experience. So the job of a home health aide or a personal care aide is to help the person to have their physical and emotional needs met by providing self-care and emotional support. So a person with a developmental disability may have more than one type of disability. For example, they may have intellectual and physical disability. Their ability to function, their ability to function may be impacted on both cognitive, their ability to function may be impacted on both cognitive and physical needs or physical levels. Remember, though, that just because a person has one type of disability, such as a physical disability, that they do not automatically also have an intellectual disability. Now, physical disability is different from intellectual disability. Some persons may be physically okay or have intellectual impairment, while some persons may be uh, intellectually okay or have physical development. So remember that because a person has one type of disability doesn't mean that they have both, or automatically he's a dwarf. Let's say now he's a dwarf. Look at him, so short. Doesn't mean his brain is also short. Or look at him, maybe he has a he is his hands are not working or his legs are not working, and I feel like his brain is not also working. No, that is a misconception. The fact that they have physical disability doesn't mean they have intellectual disability. Fine, some may have intellectual disability and doesn't have physical disability, while some may have both. But as much as it is, we are not the judge of it. So they may have physical impairments, but they may be average or above average level of functioning on an intellectual level, and they may have different types of uh, developmental disabilities. So some of the many developmental disabilities include intellectual disability, Down syndrome, cerebral palsy, autism, spectrum disorders, ADHD, hearing and vision impairment, and learning disabilities. The ADHD may be anti-direct hormone disorder. So we will explore some of these many types of developmental disabilities. So with our free time, time will not permit us to go deep into all types. There are millions, there are hundreds, there are thousands types of developmental disabilities. If you go online and you browse and you search them, there are a lot of it, more than what is listed here. There are a lot of it. So it's best after the lecture, you can just pick your phone, browse the internet, see a lot of disabilities, learn about them, and how you can help as a home health aide or a personal care aide. So here we'll be exploring some of the many types of developmental disabilities. The first we'll be discussing is intellectual disability. Now, intellectual, from the word intellect, when you tell someone that you are very intelligent, it means that the person is intellectually sound. Now, intellectual disabilities, they have we've known them commonly as mental retardation Although this term is no longer used because it is kind of offensive. When someone is mentally retarded, the first thing that comes to my mind is mad. Like he's mad. So although it's not really far from it, but we don't want to use mental retardation because it's kind of offensive and too harsh. So it means that the person's ability to cognize. Now, cognizing is it means or cognition itself means being aware of something. That means your brain being able to become aware of a particular stimulus. I know when we talk about stimulus, we are not talking about things that touch your skin. Anything, when I mean anything, I mean anything that can infringe a stimulus on you, that can infringe a sense on you is a stimulus. For example, it can be smell, it can be what you see, it can be an environment, it can be what touches you, it can be anything, it can even be the situation of Nigeria. Yes, it's a stimulus. So it is stimulating your brain to recognize the fact that what you need to work hard because Nigeria is hard. Now, I'm just using this as an example. So inability to cognize now and become aware of certain sensory uh of certain senses or certain stimuluses that infringe on us, not being able to become aware of them, we say the person is what intellectually disabled. So having an intellectual disability means that the person's cognitive ability is below the average for a person at their age. Now, making a referral back to where we started, I said developmental delay can be categorized as uh, developmental disability, and which is usually temporary. Then inability to completely perform tasks over a long period of time, over even throughout the person's life, is also a developmental disability, and that is what permanent. Now, a child of 5, not even this age, this is a child of 2. I've seen a child of 2 a child of 2 years old, 2 years old, and was pronouncing words like words from book. So intellectually, children of this age have improved even beyond or more than the previous generation. So inability uh, to cognize something, let's say when a person's cognitive ability is below average, that means it's below the normal, it's below expected. We say the person have intellectual disability. A child of 10 years old that can't pronounce some, like they cannot read fluently. If that's intellectual disability, or a man of 20 years or 25 or let's say 30 who see has difficulty reading. That's absurd. That's completely absurd. So we see that when this person's cognitive ability is below average, everyone is expected to feel when you touch them. Let's assume that you have to. Some people that I've seen a case whereby you have to hold. If you want to make the person feel pain, you have to pinch for like a little seconds before he feels that, oh, like feels the pain. So there is a delay in the brain's cognitive ability of that touch. That is intellectual disability too. So people with intellectual disabilities may range from having a mild to a severe intellectual impairment. So they are in categories. We know, of course, if you are sick, it can be acute or it can be chronic. It can be mild, it can be moderate, it can be severe. Good. So in this case also we have mild, we have moderate, we have severe. We categorize it. For people who's not so below average, we say is mild. People who are okay, well, it's below average, but it's still manageable. We say they are what? They are moderate. But people who is extremely low, extremely below average, that is what? Severe. So the lower the person run down the scale, the higher or the worse we categorize them. I hope you understand that. Now, we said people with intellectual disabilities may range from a mild to a severe intellectual impairment. And we have physical, social, and communication problems may also occur in a person who has an intellectual disability. People with intellectual disability may have a hard time communicating with others or letting their needs be known or coping and performing activities of daily living. And they may also take a longer time to reach developmental milestones, such as learning to crawl, learning to walk, learning to speak, and they may also have problems learning in school. So, intellectuality has to do with learning. And there is something called, I've forgotten the term for now, self-adultism. Now, self-adultism in a child is the first stage of a child development where the child begins to identify himself as an entity different from the world. Now, there is a key word in adultism, which is learning. A child factually learns everything. He learns to crawl, he learns to walk, he learns to speak, he learns to do like factually everything. The only thing, fine, some of the learnings are inborn, not they are self-taught, some of them are self-taught, but he has to learn them to know them. Most times if you go through the article self-advising for baby, of course, baby that advises himself for, so it's common, it's for babies and child are developing. The first thing is, or during that stages of advising, the child may not know what a fire is. So when he sees a flame, he plays with it. When he gets burnt, he learns that he is not to go close to what? To a flame. And that is when you tell the baby, Jojo, some of us say, Jojo, or fire, it will burn you. Even if it's not fire, because they've had an occasion with fire before and they know what it does to the body, they've learned that it is a no-go area. So that's when they begin to learn their body limits, learn the actually like everything around them. Now, a child who has intellectual disability, we have difficulty learning, of course. So, difficulty in learning, since we've actually learned to do everything, and the center of learning is the brain, and this person has a difficulty or a disability in the brain, we see that that affected virtually every aspect of the person's life. Inability to learn to grow, inability to learn to walk, inability to learn to speak, inability to learn to feed themselves, inability to learn to say they want to ease themselves, inability to go to the toilet and pee, they keep weighing on themselves, inability to tell the mama or the papa that I'm pressed, or make a sign. They don't just do because they can't even learn. And when the child grows and starts going to school, they have to learn in school because you have to tell them 1, 2, 3, 4, 5, 6, a lot of times just to inculcate in their mind. And due to that disability, they can't inculcate simple things into their mental faculty. This is just a pictorial explanation or representation of what intellectual disability. Now, intellectual disability can also occur due to any number of reasons, all of which occur before the person is 18 years of age. We know that if we are to, of course, growth and development it goes hand in hand. But a child begins to grow, more of growth, more of growth, more of growth, more of growth. The account begins to increase until you are 18. And at 18, growth is gradually impeded, and only what continues is what. Sorry for the breach in communication. Intellectual disability, I said, can occur due to sorry, a call intercepted. Now I said that intellectual disabilities can occur due to any number of reasons, all of which occur before the person is 18, and I've explained why. And it can be caused by an injury, by a disease, by a problem in the person's brain, by trauma while the person is in the womb, or while being born, or a genetic disorder. Now let me pick this one by one briefly. This can be caused by an injury. Example, uh, sometimes injury to where? Specifically to the brain. Now, the major thing we are looking at now is the brain. We're not looking at another part. We're not looking at the hand. We're not looking at the legs. We're not looking at the stomach. Intellectual, having to do with the mind. So it can be due to injury in the brain. What of can happen in the brain? It can be due to the fact that a disease mechanically caused an injury in the brain, an infection sets in and impedes something in the brain, or there's a cerebrovascular accident. That is, it can be, we have, that's true, it can be hemorrhagic, but it can be ischemic. Some kind of hemorrhagic, a injury towards an artery, the artery burst and then, blood starts in the brain, causes stroke. Good. So that's an injury, and also categorically a disease factor. Then a problem in the person's brain, good, like trauma also. Now, a child may, some little children, they due to the fact that they are too stubborn and playful, they don't know their limits. They may fall from height and hit the head against an object or the ground. Now, this can traumatize a part of the brain. So that's trauma. And this can also happen when the person is in the womb. This type of trauma, it's typically an hitting on the land, cause an injury in the brain due to trauma. Good, a hard object hitting the head. And this trauma also is not only reserved for children who are playful and who are working, it also can happen to a child in the womb. Like maybe the mother hits the tummy against an object, and this affects the head of the baby, or affects the baby, or some drugs the woman used while being during conception, or maybe when the child is being born, something happened. A lot of things we could picture this and expand, because we don't have limitations of our thinking. Many things can happen. So anything, I said, any reason, any number of reasons. If you look at the previous point, intellectual can occur due to any number of reasons. It doesn't have a limit. Anything. Could it be a little thing sparking and affecting, in as much as there's a possibility of it affecting something in the brain, it can be a cause. So like genetic disorder now, some type of intellectual disabilities are genetic, that they run through family. They run through family. Things like sometimes this what's it called, Down syndrome. They are that's sex-linked syndromes, and they can be passed down to the next generation. So you say a mother with Down syndrome, and definitely the child also have Down syndrome. It's very possible. So some things are genetic. Now, fetal alcohol syndrome, Down syndrome, fragile X syndrome, that's fragile chromosomal syndrome. the X is a chromosome. And genetic disorders, they occur before birth or when the child is developing inside the womb. So this means that the cause of disability is due to an environmental factor such as ingestion of alcohol by the mother in fetal alcohol syndrome. Like for fetal alcohol syndrome, now we mean that fetal alcohol syndrome. Fetal, the baby in the womb, alcohol, the normal alcohol syndrome. Who takes alcohol? The mother. Good. So when the mother is ingesting alcohol, literally alcohol is not good for a pregnant woman. We all know that. But some people are so adamant that they don't care. Take alcohol, they be happy, they call it be happy, they're happy. What happens? A child may be given birth to with a fetal alcohol syndrome that affects the brain, and child has what? Intellectual disability, inability to learn. So you see that child learn. When I say learning, a lot of varieties may not be able to learn to crawl, learn to walk, learn to eat, learn to pee, learn everything. So say in the case of Down syndrome or Fragile X syndrome, a genetic mutation occurs while the baby is developing, and that is what we call a congenital defect. And congenital defects or congenital anomalies, whatever word it is called, is a disease condition that happens to a child at birth, like before the child is born with it. So these are defects in genes or chromosomes, and trust me, they can be passed down to generations since they're genetic and chromosomal. Now, the next type of developmental disability we'll be discussing is cerebral palsy. Now, cerebral palsy is a group of disorders that affect muscles coordination. Now, there is a normal physiology of muscle contraction, and that's muscular coordination. I said something when we started about motor function impairment. If anything happens to the brain that affects the motor functions, it may impede effect of some certain parts. Now, when we say cerebral palsy, so it is a disorder that happens in the brain. It happens here, but it doesn't affect the head or the eyes. It affects what? Muscle coordination. Now, palsy itself means weakness having to do with muscles. So bring the word cerebral as brain, palsy, weakness of muscle. So weakness of muscle as a result of what? A disorder that happened in the brain. So this occurs due to brain damage that can occur while the baby is within the womb or during birth. Remember, most of these things don't happen to adults at adulthood. It happens either at birth or even before birth. Happens at birth or even before birth. So the symptoms of cerebral palsy vary from one person to the other. Some people may just have some trouble with motor coordination, like doing things like moving, walking, or controlling their hands and movement, while some may have severe impairment and will not be able to walk or perform activities of daily living and rely on others for their care for the rest of their lives. Now, let me come again. Some people have just some trouble with coordination, like they will move, but they are not moving well. They will still walk, or maybe they have to tip or to leap rather. For most of them, their hands are, in a kind of shape that they don't have the ability to control their hands well, but they can still perform some activities for themselves. For some other persons, some other children may have a severe impairment. Remember, we said that most of these diseases are ranged from mild to moderate to severe. So in some severe cases of impairment, the person may be unable to walk or perform activities of daily living, and they have to rely on others for their care for the rest of their lives. Now, while some people with cerebral palsy only have problems with what their motor function and ability to control their muscles, some of them may also have intellectual, learning, vision, hearing, or speech problems. We said something that when a person has physical disability, they don't automatically have cognitive or uh, mental disability too. They may have physical disability, but have intellectual ability, or vice versa, or even both. So here, some people may have cerebral palsy as their only problem. That is, but some may have both intellectual, learning, hearing, vision, speech problems as well. Now, cerebral palsy, some of the symptoms you might see with a person with cerebral palsy includes that stiff muscle, they call it spasticity. Spasticity, that's stiff muscles. We have dyskinesia, uncontrollable muscle movement, inability to control their muscle well. They're not, it's just uncontrollable. Because of the ataxia, that's poor balance and coordination. I come again with the words spasticity, dyskinesia, and ataxia, and the meanings are there. So in spastic cerebral palsy, that's stiffness of the muscle, according to CDC, it affects 80% of people with cerebral palsy, people who have muscle stiffness, which affects their ability to move. This thing is quite understandable and direct. When we say spastic cerebral palsy, that's spasticity of muscles, stiff muscles. Before you move from one place to another, I can't picture my leg right now, but just picture your leg and imagine your leg is stiff. You need to relax and contract, flex the leg, extend, flexion and extension to move from one place to another. Flexion and extension of both legs at what? Specific intervals. You can't move both legs at the same time. One must go before the other. Good. So when the person muscle is stiff, you can't flex, you can't extend, you can't contract, you can't relax. It's just there. So it affects the ability to move from one place to another. So they may have stiffness in both legs, one side of the body, or both arms and legs. So it may affect the hands, it may affect the legs, it may affect side, maybe the right side, that's the right side, rather, the right hand, the right leg, or the left side, left hand, right leg, or both hands. It can affect any part as it will. So in this kinetic cerebral palsy, people have trouble controlling their muscles, movements, and their movements may be jerky or uncoordinated. When they are walking, they will be as if they want to fall. I think, uncoordinated movement. When you are jerking, like yeah, it's not like they cannot control their muscles. Yes, they can relax, extend, and flex the muscles of the leg, the legs to move, to take them from one place to the other, but it is not coordinated. One thing that gives us balance is coordination, but they lack that, so they are not balanced. They don't move, balanced. Then it can also affect the ability to swallow and chew too, because why? You need the muscles to chew, and there are muscles here too that you need to swallow. So when they are not coordinated, let's say assume that it's hard for you to control. So it's hard for them to swallow and even to chew food. Then in ataxic cerebral palsy, that's ataxia, people have problems with coordination, which affect their ability to walk or perform activities easily. So coming back to coordination, so they have issues with coordination, and they have trouble with fine muscle movements such as writing or using the fork and knife. Unlike this kinetic cerebral palsy that has to do usually with movement, this guy here, that's ataxia, has to do with fine motor movement or fine muscle movement like writing. Now, there is a complex, it said growth is both simple and complex. Simply, a child can move his hands like this, but to hold a pen between two fingers and write is kind of a complex development. So this ataxia affect those complex developments where they have to make their fine muscle movements, such as writing, holding a fork, or holding a knife. And all these types of cerebral palsy can affect a person's ability to perform active cerebral living. So we are coming back to that. It affects their performance of what? activities of daily living, and they won't be able to care for themselves. Someone who cannot control his hand or cannot even control his leg, how will he wear clothes for himself? How will he take his bath? How will he brush his teeth? Who is uncoordinated and he cannot even control his muscle? How does he want to control? You have to control your muscle in a fine direction. Brush like this. Good. So they can't even control their muscles well. So they will not be able to perform so many activities for themselves, such as activities of daily living. People with cerebral palsy may be able to live. People with cerebral palsy may be able to live independently or may require care throughout their lives, depending on what type of cerebral palsy. They may be able to live independently as well as for some of the kinetic cerebral palsy may still be able to live or even ataxia cerebral palsy may still be able to live. But cases like these that's spastic cerebral palsy where legs are stiff, the hands are stiff, or let's assume that both hands and both legs are stiff. This person cannot. So they have to live or require care throughout their life. The next is autism. Autism is another type of developmental disability. Now, there are a variety of types of autistic disorders which can affect a person's ability to communicate their social interactions and may cause behavioral problems. Now, autism is generally or simply inability to communicate, inability to have social interactions. So this can cause varieties of behavioral problems. Now, autism ranges across what is called the autism spectrum. This means impairment may range from mild to severe. We've always discussed that impairment are always from mild to severe, and most people with autism appear to look like anyone else and do not have any obvious disability. Now, someone with autism has no physical disability. Their hands are complete, their legs are complete, they are physically fine, they are okay. People with autism can range in their ability to learn, communicate, interact socially, and behave. It's even recorded that people with autism have they are highly gifted and they have above average IQ scores. Most of us have had autism. Autism is not a new word, it's not a new disease condition, it has been existing, and it is common among uh, these people who have autism. Like most children who have autism, they have good intellectual capacities. So some people with autism said they have severe learning, social, and behavioral impairments, which greatly impact their functioning, while others can be gifted. So it's not exhausted. Not all children who has autism have good IQs. So some of them may have good IQs, some of them are highly gifted, while some have severe learning and social behavioral impairment. So this is a picture. How do you know if someone is who seems to like has autism? That's the symptoms of autism. You have staying alone, overthinking, anxiety, no eye contact, attention to details, increased IQ, trouble regulating emotions, and being inflexible to change in routines. And the fact that they have increased IQ, let me say something about that. The fact that let's go back. So the signs like this. So the fact that they have increased IQ, and I said not all of them necessarily have the increased IQ because due to the disease condition, they have a wider range to use more of their mental faculty. They're just saying that those who talk less think more. And the more you think, the more you are sharpening your mind. So due to their condition, the specialty, the specialty of their disease condition, that is, they are mute, they don't talk, they love staying alone, so they have more time to focus to those who wishes or deliberately wants to bring, make good use of their condition. So now, autism. In early childhood, parents may begin to notice things in their child, such as avoidance of eye contact, not liking physical contact, such as hugging, having trouble interacting with others when they speak with them, difficulty being empathetic, understanding how another feels, or repetition of words or actions. Or they may seem as if they are not interested in others around them, or that they do not know how to interact with others, or maybe or there may also be issues such as having hard time adapting to changes in routines and behavioral issues such as maybe temper tantrums when such changes occur. And according to the CDC, 1 in 68 children has autism. That's autism spectrum disorder, called it ASD, autism spectrum disorder. And there's a known cause because there appears to be a strong genetic link to having autism. This means if a sibling has autism, other children in the family are more at risk. And according to the CDC, there are also evidence that suggests older parents, some medications that some women take while they are pregnant, they also linked to a higher risk of children having autism. While there is no cure for autism, early childhood interventions can greatly help a person with autism to cope with social emotional stressors and learn to function as normally as possible. Speech, occupation, and behavioral therapists may also be included in the care plan for these children. There is factually no cure, but it can be managed. And in managing this, you help them to cope with social, emotional stressors, help them to learn function as much as possible, help them with speech, help them with occupational and behavioral therapies. Medications may also be used to help with behavioral issues. And people with autism may be able to live independently, or they may be dependent on others for their care. Now, to those who make the good use of their condition, they may be able to live independently, but to those who doesn't, they may have to depend on others for their care. Now, the next type we are looking at is multiple disabilities. When a person has multiple disabilities, it means that they have more than one type of disability. Now, we said that a person can have one disability or more than one type of disability. And they may have a physical disability plus an intellectual disability. They may have a behavioral impairment that impacts the ability to learn and also have an average, or above average intelligence level. So it's also always important for home health aides and personal care aides to find out about the unique strengths and needs for the person with whom they are working. Okay. Now, never assume that a person with a physical disability also has an intellectual disability and vice versa. What are we saying? We said multiple, more than one disabilities. So one person having more than one disability is simply multiple disabilities. So we said categorically there are mainly two, as other types fall under these two: physical disability or intellectual disability, that's mental, that has to do with the brain. Now, it's either someone has physical and doesn't have intellectual, we say the person has physical disability. Then someone has intellectual and doesn't have physical, we say he has what? Physical intellectual disability. But when he has both, he or she, we say it is what? Multiple disabilities. So we are not to assume that a person has both disabilities until you are sure. Don't assume. Never assume. So let's look at the effect of disability on development. So briefly again, before we move to the next point, we talked about the types of developmental disability. And we said we have the intellectual disability, we said we have the cerebral palsy, we We said we have the autism and we have the multiple disabilities. Now we are going to the effect of disability on development. Effect of disability. Effects can both be positive and negative. You have positive effects, you have negative effects. But in this context, does developmental disability have a positive effect? Let's answer the question on your own. It doesn't, because it reduces life expectancy. It makes you or the person completely dependent on another. Causes varieties of frustrations, of things like emotional disability, like frustrations, anger, and the like. So we look at the fact that there is nothing positive coming out from developmental disability. So the effect of disability on development is that developmental disabilities impact growth and development in varieties of ways and depends on the type, as we said earlier, and the functioning level of that person. And we said that everyone is unique, so no two persons are alike. One person with Down syndrome may be able to live fairly independently, while another person with Down syndrome may require constant supervision. So the effect as follows: people with intellectual ability may have trouble with learning. So the first effect is what? Learning. Learning impairments. They have trouble with learning and require special help to learn skills such as reading, writing, and mathematics. You see those children who have difficulties in learning, they don't just go to a random school. You know why? Because random schools doesn't pay special interest or special attention to those cases. These children can be intelligent, but they can't learn like a regular person would. They need a special type of teaching, of treatment. So people with these intellectual disabilities have trouble with learning, so they require special help to learn skills such as reading, writing, and mathematics. So learning may occur at a slower rate compared to other children of the same age, but they may learn. They will still learn. People with cerebral palsy may have trouble with motor skills. Now, for better understanding, let me go back again and categorize it properly. Effects of disability on development. Number one, for people with intellectual disabilities, they have what? Trouble with learning. Abi? Then they may require special treatment or special help, such as in learning skills such as reading, writing, or mathematics. So, and their learning will be quite slower than a child of a normal age of their same group, like same age group. Now, effect of disability on development pertaining to cerebral palsy now. People that have trouble with motor skills and require assistance learning how to perform activities of daily living independently, and they may also require total care. So, number one, now sorry, the second category, which is cerebral palsy under the effect, we said they have trouble with motor skills. What are motor skills? Movement is a motor skill. Eating, of course, is part of motor skill because you have to move your hand. Good. So they require assistance to learn. Some of them may not be able to even perform it by themselves independently. So they require what? Total care. Then the ability to learn motor skills such as walking and feeding may happen at a later time compared to other children of the same age. But those who have developmental delay, they may still learn to do walking, they may still learn to do running, but at later times compared to the children of their age group. Now, for people who have autism, the effect is that there is impairment in communication and social skills. Communication and social skill impairment. They don't like to talk, so you can see them within a social gathering, and they don't want to talk to people, they don't want to communicate, they're just alone. So they also may need extra support and behavioral interventions to help them communicate and interact with others. They may need extra support. Like I said, they are also humans. They will also live and meet life expectancy, but not as an average person would. They need special support, special treatment, to interact with others and help them communicate with others. And the ability to interact with others may take a longer time compared to other children of the same age. For children that have neurological impairments, they may have trouble with their senses, like vision, hearing, tasting, feeling. So they don't feel, they don't taste well. Now having issue with their senses, so they're not the vision is not good, is impaired, or hearing is impaired, or olfaction, that smelling is impaired, or tasting is impaired, or feeling is impaired. So they may not have any other physical or intellectual disability, but they will require what? Assistance with learning how to function independently due to all these disabilities. Learning language and communication with others for a child with a hearing or vision loss may happen at a later time compared to children of the same age. So for those who are not permanent, it may happen at a later time, but they may still regain it. For those who are permanent, they may never be able to function in that perspective throughout their life. So it is important for home health aides and personal care aides to be familiar with the timeline for normal development milestone. How do you know an abnormality without knowing what is normal? So we have to know what the normal developmental milestones are to be able to categorize delay or impairment as abnormal. So if you notice that a child with whom you are working is not meeting the developmental milestones, discuss the concerns with the supervisors. So as a healthcare team, can further assess the child to see if special testing and additional resources and support should be done, which would be helpful. So here's a diagram expressing the neurological disability, sight, hearing, walking, feeling, and the likes. Everything has a cause. Fine. Some causes may not be known. Some things have an unknown cause, but they have a related factor. So we want to discuss the causes of developmental disabilities now. Causes of developmental disabilities. What causes developmental disability? What is the genesis of developmental disability? As we know, developmental disability can occur in several ways. Some are due to congenital defect, that is, defect at birth. Problems that occur during development of the person when they are in the uterus and due to a mutation or error in genetic coding of their genes or chromosomes. That's before birth. An example of this is Down syndrome or Fragile X syndrome. Developmental disabilities can also be acquired, that is, obtained after birth. Now, it is before birth as a congenital defect or congenital anomalies, or as a developmental disability after birth, that is acquired. They can come from an infection that occurs during pregnancy, or women that need to take special care to remain infection-free, and to avoid people and children who have bacterial and viral infections. Pregnant women, they need to take special care to remain infection-free. Pregnant women should be very careful so as not to contaminate themselves, because contaminating themselves may as well affect the child. And also avoid people and children who have bacterial and viral infections so that you can pause and umbrella to touch them, to infect them. But these diseases may not necessarily affect the mother, but has a higher effect on the unborn child. Like there's a bacteria here called toxoplasmosis. Toxoplasmosis is a bacteria that is ingested by eating undercooked meat. or handling cat faces, such as while cleaning out a litter box. So this toxoplasmosis has a lot of serious effects on the unborn child. So pregnant women are careful not to come in contact with this disease, not just this disease alone, other diseases like gamma measles, rubella, and other things as these infections generally. Because why? Your baby is at risk. Anything, any little thing can cause a genetic disposition, can cause uh any factor that it can cause variety of things to that will lead to developmental disabilities. So now, developmental disabilities such as cerebral palsy are often caused by brain damage. Cerebral palsy, inability to what? To move the muscles, to control the muscles. Cerebral from the brain, good. Cerebral palsy also caused by what? Brain damage, maybe due to loss of oxygen, or during development of baby or in the uterus. It may be caused by birth injury or an infection too. So the person that has cerebral palsy mostly is caused by what? Brain damage. That is, the brain is not receiving excess or enough oxygen, enough nutrients as it needs. Then developmental disability can also occur due to poor prenatal care. Poor prenatal care the mother receive while being pregnant. Some women doesn't even really care about their health. Some women doesn't even they don't care. They don't care about they are so nonchalant. Don't eat this, don't take this, don't do that. They don't care. They do whatever they want. So these things can affect a baby in the womb and it's giving birth to with a developmental disabilities. If, for example, a pregnant woman drinks alcohol, she smokes or uses drugs or does not receive proper nutrition, her child could potentially have a developmental disability, like the disease called fetal alcohol syndrome (FAS) can also cause fetal physical and intellectual disabilities and also birth defects, leading to what the general name called the developmental disability. Fetal alcohol syndrome is one type of developmental disability that can be 100% prevented if you don't take alcohol in pregnancy. So many diseases can be prevented. So you see, the reason why developmental disabilities are so rampant in our world is because these things could have been prevented, but negligence, maternal negligence now, set the child at risk. So if home health aides or personal care aides observe that a pregnant woman with whom they are working is drinking alcohol, you should immediately report this to the supervisor. Report this to your supervisor. If in any case you see them taking a sip, just a sip of alcohol, please don't be too quiet. Take action. Pregnant women need to take special care during their pregnancy by eating a healthy diet, taking prenatal vitamins their physicians prescribe, refraining from ingesting cigarettes, alcohol, drugs, or any infections. Like, so smoking, drinking, and using drugs while pregnant increases the risk of baby to be born premature and have a low birth weight, and also what developmental disability. So premature babies, like the births that occur before the baby is fully termed, like before the 37 week of gestation, or low birth baby that have low birth weight of less than 5 pounds to 8 ounces or at birth, they also they have higher risk of having what developmental disabilities, because why? They did not have enough time in the uterus to what properly develop. Now, the fact that they smoke, drink, take drugs, the child will become what? Poisoned. So this leads to what? Poisoning, and this can also cause a child to have a developmental disability. And they said this type of disability occurs after the child is born. So lead can be found in number of sources, such as construction materials, batteries, and paint. So, sorry, a brief recap. Lead poisoning can also lead to a child having a developmental disability. Now, lead is found in numbers of sources such as construction materials, batteries, and paint. Homes and buildings used to be built using lead materials. So children who live under homes are the most at risk for lead poisoning, as lead may be in the building materials or the paint that is used. So some children are very sensitive to lead. So children are sensitive to lead that lives in a house whose material was made by lead may develop a developmental disability. So children tend to put many things in their mouths, like lead. So lead poisoning can occur if a child now ingests the paint and any other materials that are made of lead in that house. So lead poisoning can impact a child's physical development, such as muscle problems, bone problems, and it can cause severe behavioral problems or cognitive problems, such as maybe difficulty in paying attention and learning, or anemia, that's low blood count, and it can cause a variety of disease conditions at large. So the good news is that people who live in older buildings can have their paints tested to check for lead. And there is concern about this, speak to supervisor. So lead in itself can be very detrimental. It's a poison. It's poisoning. And when our children put everything in their mouth, like the oral stage I made mention when we started, oral stage of sigmoid stage of development. Child develops gratification from biting, sucking, chewing, anything from the mouth. So whatever they see goes to the mouth. Whatever they pick goes to the mouth. Whatever they see, the mouth. Now, when the child ingests material that has lead, it can impact their physical development, cause behavioral problems, affect blood count, and even affect their weight. So we see that it has a wide range. So it is a dangerous thing for a child to be exposed to lead poisoning. So we are careful to use materials that have lead in our home when we have a child who is just developing. But in the case where we can't really help it, we are to monitor the child carefully so as not to ingest any material that contains lead. So if there's a concern about this, please speak to your supervisor. So these are other factors that can cause developmental disabilities. We have the genetic factors, prenatal illness or issues, childhood injuries, or environmental factors. And there we have the Fragile X syndrome, the PKU, the Down syndrome, fetal cord syndrome, as it is. And let's move next to how is a developmental disability different from mental illness. There's a lot of misconception that developmental disability, especially intellectual disability, as not different from mental illness. And that's why we said that mental retardation as an explanation to intellectual disability is kind of offensive, because the only way many people describe mad people with English is he is mentally retarded. So we believe that mental retardation is same as mental illness. The person is mad. So let's see how developmental disability is different from mental illness. There are several differences between a person who has a developmental disability and a person who has a mental illness. Developmental disabilities are permanent, while mental illness may be temporal, with recovery being possible. The prognosis of uh, mental illness is good, but developmental disabilities may be permanent. Fine, we have developmental disabilities that are not permanent. Those that are due to developmental delay, they may also regain and move on, but some are permanent. So a person is diagnosed with having a developmental disability before the age of 22. I told us that it starts from infancy to age 18 and at most 22. And often when they are babies, it happens within this age. But a person with mental illness can have it at any point in their lifetime, from both childhood to adulthood. A man of 50 can develop mental illness. 55, 40, 30, 20, even a child of 10 can develop mental illness. So mental illness is usually at any age, while developmental disabilities occur from infancy to age 18 and at most 22. And how is developmental disability different from mental illness? Again, we have a person with a developmental disability may have mental illness. Fine. It is possible for someone with developmental disability to also have mental illness, but it doesn't necessitate the fact that anybody with developmental disability has mental illness. No. Fine, a person may have both mental and developmental, but it may be evident at a young age or it may develop later in life. So they are two different. The fact that they exhibit both doesn't mean that one influenced one. No, they had both because the both developed. Like they have both. One doesn't influence one. So a person may have developmental ability and not have mental illness, but a person may have both mental illness and developmental disability. So regardless of when it develops, it is important to remember that a developmental disability and a mental illness, they are not the same thing. So a child may develop disability at, of course, at birth, maybe at age 2, kind of noticing that, oh, this guy or this girl is developmentally disabled, and at 15 or at 20, he develops mental illness as well. So they are not the same thing, and the way we handle them is also not the same. So they must be treated in what? In special ways. So for a home health aides or personal care aides, it is important to be aware of the signs and symptoms of mental illness, as we have discussed in the previous module, module 5. If a person have difficulty performing everyday tasks, caring for themselves, communicating with others, and being able to be independent, they may have feelings of frustration, depression, anger, anxiety, and hopelessness. So one way we can support them those one way we can support those who have developmental disability or mental issues is to help them with what? Teaching them positive coping strategies. Positive coping strategies. As health care, personal care aides, and home health aides. One way we can help those people who have this developmental disability or those that have mental health issues, we help them to what? Learn how to cope. There's something called the positive coping strategies, and it was discussed in module 5. Help them what? Learn how to cope. Finally, look at the picture on the screen, the differences between mental illness and physical illness. For mental illness, the less of physical disabilities, the person cannot walk and perform activities of daily living for themselves. For mental illness, the person what? Begins to overthink, feels bad and behaves irrational. Those are the signs you see. You know that, oh, this person is having a mental illness. But on the contrary, not being able to walk, not able to think properly, difficulty in learning slowly how to, learning at a slower rate. All these are characteristics of physical developmental disabilities. So we have come to the end of this module. Just a brief recap from where we started to give us an insight we talked about working with people with developmental disabilities. And we introduced ourselves to the module and as well as what we'll be choosing in the module before we are done completely. And we talked about what developmental disability is. And we explained a lot of things as that it begins with childhood and impact that relates to function in one or more areas. And we also talked about how this developmental delay affects the normal development. And we said in self-care and movement, how it affects them there, financial independence and self-direction, about communication and social situations, and about coping. Then we talked about types of developmental disabilities, and there we said we have intellectual disability, we have cerebral palsy, we have autism, we have multiple disabilities. Other disabilities are there, like all those Down syndrome, uh, and examples as there is. Then we talk about the effect of disability on development, effect of disability on development, and there we're talking about the fact that it affects learning as in intellectual disability, it affects motor skills as in cerebral palsy, it also affects what impairment in communication and social skills as in autism, and also what um, how that they need extra support and behavior and the behavioral interventions to help them communicate with others. Then also we talked about the causes of developmental disability. And we said there are a lot of causes of developmental disability, as all or some could be congenital defect, while some could be what? Acquired. Acquired developmental disability, that's after birth, and some are before birth, that is congenital defect. And we talked about pregnant women being careful to take in of alcohol, drugs, and what? And cigarette, that's smoking, because this can affect the child and impedes the child's growth and development. And we said that an example is the German measles, chickenpox, and etc. There are also disease and viral effects that can also affect the baby, as well as toxoplasmosis. This can all affect the child's growth and development. Then finally, we talked about how is developmental disability different from mental illness. How is developmental disability from mental illness? And we said that developmental illness is different from mental illness. Developmental disability, rather, is different from mental illness. A person with developmental disability can, yes, they may have mental illness, but then it may be evident at different ages. And we said that the difference majorly is that developmental ability occur within the age of what? 0 to 22 as the highest range. Then for mental illness, it can occur at any age. And finally, we have a picture that explains or that depicts differences between mental illness and uh, developmental disability. And we see that in developmental disability, major thing there is that activities of daily living has been impeded. This child cannot perform such. But then in mental illness, person feels, behaves irrational, is hyperactive, always thinks, irrational, and the likes. Thank you for your time. Have a wonderful day.